There's a bigger issue that is about happening. That is the strike that some nurses want to embark on. We understand they've not been paid for 11 months. No,
Yeah.
you wouldn't be able to survive if you've not been paid for
That's a lot.
11 months. That's a lot. That's a lot. So
That's like working for free for almost a year.
For almost a year.
And then you be saying, and oh my God, it reminds me of one of the sound bites on radio. I've been working, and the only thing you tell me is well done. Is it well done? I used to pay my rent, you know. I think it's a lot. Issue. You know, let's be realistic.
But there have been calls that the government should see what can be done about it. If really, this morning on the with Nana Tufo and the guest, there was also another aspect to the conversation that really the COVID-19 money could have been used to defray the cost by paying these nurses and all that. But let's bring you a report after. We would speak to the authorities that be and find out from them what's the make of this demand that the nurses are making, and also you speak to the nurses themselves.
The group, with about 6,000 members across the country, laments that while some have received only 1 month's payment, about 300 members have not been paid a dime since they began work in December 2024. The aggrieved members say government's delay in honoring their payments is having a toll on their lives.
I want to thank the Ministry of Health for paying us our 1 month salary, but it is not enough. It is affecting us in the sense that we are paying for rent, we are paying for our daily life expenses, and if you give us 1 month's salary, the debts, the past debts, we don't know how we are going to pay it.
We are saying, or we are not pressuring the government that pay us all the full arrears instantly, but at least show us the way. Okay, we are going to pay it installment. Maybe after this November pay, maybe after that one, we are going to give you 3 months, 6 months.
The group has described the government's posture as deceptive following recent promises by the Ministry of Health. A payment plan will be released after the payment of the November salary.
Today, it has been weeks of complete silence, no roadmap, no timeline, no communication. Instead, what we received is a misleading press release from the ministry claiming that they have paid us, when the reality on grounds is just directly the opposite of what the ministry communicated.
The members at a press conference held at Edisu in the Ashanti region called on the government to honor its promise and settle all outstanding payments.
11 good months, that's a lot. And the fact that they also made mention of the fact that after the November salary was paid, there was a payment plan that was agreed upon, but the government hasn't followed that. 11 months, that's a lot.
I think that's a lot, because at the end of the day, when you listen to what the lady mentioned, that's everybody's daily life. Apart from your daily expenses, you have rent to pay.
Yes.
And rent is the place that you sleep, the place putting a roof on your, like the roof on your head. So if you cannot pay that, where will I be moving from to work?
Maybe we need to know the reason why their salaries have not been paid, and because the government is the biggest employer. So when it comes to this situation, there's definitely the government should be able to find a way to pay these nurses so that they can go about their day-to-day activities. You don't want to go through school 2, 3, 4 years, and later when you come back, you are not getting your salary. But the gentleman who covered this story for us, the Middle Belt Bureau Chief Hafiz Tijani, is joining us for us to understand that beyond what we saw on screen, how the mood of the nurses was, and also the issues that they raised aside the salary that hasn't been paid. Hafiz, good morning.
Yeah, good morning.
I trust you are doing well.
I'm well, thanks for asking.
So where exactly did they hold the press conference?
Well, it was held at the nurses guest house, the guest house for the Ghana Registered Nurses and Midwives Association at Krapa in Edisu municipality.
And from what we saw a few of them, but were they there in their numbers?
Yeah, cut it up a bit.
Hafiz, we are losing you. If you want to position yourself well so that we can... Hello?
Morning.
Okay, maybe you would have to re-establish contact with Hafiz because the line isn't clear. But if this is the demand they are making, we've been on this show and we've spoken about the health care situation in some communities. A bigger problem is if you are not paying me and you expect me to go to that deprived community and do my best in that deprived community, what am I living on? What am I really surviving on? My parents know that you are working at the end of the month. You are supposed to either send money some back home, or even if you are not sending money back home, the age you've gotten to, you're not supposed to depend on the parents again, or you're not supposed to depend on the guardian again. And the government is not forthcoming with the amount of money that has to be given to you by way of salary. Maybe health ministry will need to hear from you, Minta Kando, or the public relations department of the health ministry. You need to know really what the roadmap is and what really has held on to the payment of the 11 months salary. Not one, not two, not three, 11 good months. Hafiz is joining us again. Hafiz, good morning.
Yeah, good morning.
Good. So I was asking you what we saw the numbers on the screen, but I want to find out from you whether they're in their numbers or is this the leadership that held this press conference?
Well, so they have members scattered across the country. So many of them are still at post, and some of them who are in Kumasi and within the Ashanti region, they were able to make it up for this press conference. But just to echo the sentiments of their colleagues. So for them, it's not about the numbers, it's about the message. So they wanted to send a message to the minister and also the authorities who are supposed to ensure that all their salary arrears are paid. So for them, the problem is not about the payment. So even if the government should settle all their monies now, they will have to go and then defray some debts they owe. Most of them complained about the rent, the transport. Sometimes they fall on their families to get help, to even get transportation to the workplaces. And that is very, very, very sad for them. And they are also complaining about, we are getting close to the festive season. How they are going to spend the Christmas and the New Year is another problem for them. So they want the government to give them a proper roadmap where the payments can be done and what the government would do just to settle the money.
And as we speak now, did you get to know where some of them are serving? Maybe deprived communities or some village somewhere? Did they tell you all that, or did you get that information?
Well, so for most of them who came, majority of them within hospitals in the Ashanti region, within major hospitals in the Bono and Ahapo regions, and some of them also worked at the Konfanoti Teaching Hospital. So one of the ladies I spoke to, she was complaining. She works at the trauma department of the Konfanoti Teaching Hospital, and the kind of cases that come to this department and how they are able to take care of these cases. And she says that the trauma alone, or maybe the stress alone she goes through, if she's adding the thought of not being paid for 11 months, that alone sometimes demotivates her, and she doesn't have the goodwill to even serve. But this is what she has sworn to do. This is what she has gone to school to study, to serve Mother Ghana. So she has to just bear with or endure some of these situations and then go ahead and work.
Did they give any timeline as to when the strike will be happening?
Well, for them, they have given government after this month. If they do not hear anything, then next year in January they are going to lay down their tools.
And in the interim, have they been able to get any message from the government as to hold on to it, or nothing at all of that sort?
Well, after they did a demonstration and the minister came to promise them and giving the roadmap for the payment, They say they've not heard anything from the government again, not the minister. So they are only using the media to send their message to the minister, the ministry. Not only the Minister of Health, but the Minister of Finance also.
Are there series of actions that will be taken prior to the strike that they may be embarking on?
Well, they said they will be having meetings with their leadership. You know, they also work under the Ghana Registered Nurses and Midwife Association, and then they will want to consult them further so that they can give them the directives so they can embark on the action they want to.
And prior to the press conference, have they submitted petition to any of the authorities, the health ministry, the Ghana Health Service? They are
yes, according to them, they have made several attempts, and also they have had some engagement with officials of the ministry, and they have had some promises, but some of these promises are not being fulfilled. So they think that it's time to speak up, and they will continue to speak up until these concerns are addressed.
So, though this is in the Ashanti region, it's nationwide, right?
Yes, it's nationwide. They have over 6,000 members nationwide, and out of that, 300 of them have not even had the 1 month salary. Majority of them were paid for the 1 month, but 300 of them outstanding have not had any money from the government since they started work.
Wow.
So, which means they are yet to get even a month's salary. So 12 months they have not been paid.
All right, so talking about the one in Ashanti region, does everybody actually come from the Ashanti region?
Yes. Most of them work within hospitals. You know, they've been posted from different institutions and different regions. So most of them work within hospitals in the Ashanti region, and some of their leadership or leaders, they came from the Bono and the Ahafo region.
Wow. Hafiz, thank you so much for your time. Hafiz is Middle Belt Bureau Chief for ChannelOne TV and City FM, and he covered the press conference there in the Ashanti region, where the nurses are saying that they will embark on a strike if their 11-month arrears is not paid immediately by next month. That will be in the month of January 2026. They will be embarking on a strike. And of course, I heard somewhere, if these essential service providers embark on the strike, people would die. Simply, it just ends there. People would die.
No, but we saw the last
one. When the last strike they embarked
when you go to the hospital, nobody even minds you.
Yes.
Nobody even minds you. Like, people were turned back even in labor.
There are people we need in our hospitals, in our clinics, in our CHIPS compound. Almost all health facilities really need nurses, because they are cleaning wounds. They are helping people deliver. They are giving you your paracetamol. They are helping you at the OPD. They are helping you through the entire period. Every little thing. Mommy-ness, papa-ness, our-ness, papa-ness. So we should find a way to resolve this issue before it gets there.
Yeah, and I like what you said before you started the whole conversation with Hafiz. You're like, on this show, we're always showing deprived places.
Yes.
And there are some hospitals that obviously need nurses, or some areas that need even hospitals. So if you're not paying the nurses, how do you even expect them to go to some of these areas?
We certainly will not even go to that area at all. Anyway, we have the convener, coalition of unpaid nurses and midwives, Ghana, Stephen Techi, on the Kojo Techia on the line. And he's going to tell us details of this action they would want to embark on next year. Good morning.
Good morning, sir.
I can say you are not fine, or you are fine.
Oh, I'm not that well, sir.
You are not that well. You say you are owed 11 months salary. Is that the case?
Yes, please. You are perfectly right.
How did we get here?
Thank you very much. Let me say a very good morning to your cherished viewers this morning. We are nurses and midwives from across Ghana who were engaged by the Minister of Health Ghana some of us started work in December of 2024 and most started work in January of 2025. We were a total of 13,500. But somewhere in April, a portion of our colleagues started receiving their salaries. They were placed on the payroll. So at the moment, that portion, which totaled about 7,000, have been receiving all their salaries since. But the remaining of us who are around 6,500, we didn't receive a penny until in October when we had to hit the streets with a demonstration, after which we got called by the Ministry of Health and a press conference was held where the media were present. And that was when it was made public that Cabinet has issued a statement and an order for the Finance Ministry to release funds to clear our salary with the arrears. So the ministry gave us an assurance that they were going to pay us 1 month's salary in November 2025. But before then, they will bring a clear payment plan as to how they are going to clear the entire accumulated arrears. We waited patiently, and the ministry did as they said. In November, they enrolled us on the payroll, paid the 1 month's salary. But with that, even there are a few of our colleagues who didn't receive the 1 month salary, and now their fate looms in danger because by December 31, the extended financial clearance is going to expire. And so for that matter, if these colleagues do not get enrolled on the payroll before the expiration of the clearance, then the probability of them being sidelined is very high. At the moment, the ministry has been silent on the promise they made that they are going to bring a clear payment plan for our salary arrears. And to our surprise, not long ago, the ministry released a statement indicating that all the nurses and midwives have been paid. And this miscommunication, or let me say misinformation, has resonated into the ears of the public. For that matter, people we had borrowed money from are now on our necks demanding for their monies. We tried explaining to them that that's not the truth. Government paid us just 1 month, and even with that, not everyone received. But people are not trying to understand this, in that they believe the press statement that came out over what we are saying. Now we are sinking in debt. Emotionally, we are being traumatized, and we need urgent action in that. We need our salary arrears to be paid this December 2025. Thank you.
Is it that with the over, is it 6,000, right?
Yeah, over
Good.
6,000.
Over 6,000 that you've not been paid. Have you been able to satisfy all the conditions? We know there is a process you have to go through for the paymasters to know that you are verified. There is this biometric thing you're supposed to do. Take us through the process. Have you been able to go through the entire process for the payment to hit your account?
Sure, boss. Thank you. Every one of our members has gone through all the necessary process and all the necessary administrative work. And now the only thing left is for them to enroll us on the payroll, which now they've enrolled most of us. Even to our utmost surprise, last month in November, most of our colleagues were validated to receive their whole arrears. But surprisingly, payment came and they received just 1 month out of the entire arrears being validated. So we know this is something intentional. Yes, and we are just demanding for justice and fairness.
All right. If I would like to ask a question, it's actually something very personal. How do you survive?
Me personally, I was even discharged from the hospital about 2 days before we came for the press conference yesterday. I thank God I nearly was diagnosed with ulcer. We borrow money from colleagues, people, and even at the moment, the worst thing is because the ministry issued a statement that they have paid us. When you need support from somebody, they are hesitating to give you because they think now you have been paid. We depend on quick loan from colleagues. We borrow to settle outstanding debts. It's not been very easy at all with us, and just pleading.
Right. Also, this might sound a bit personal, but how much is the 1 month salary?
Maybe you want to give us a range.
Oh, sure, because we are, different categories of nurses and midwives. Some enrolled, some, staff, some officers. So
yeah, so you can just give us the lowest to the highest.
Yeah, ranging from somewhere 2,000 cities to around 3,009, 4,000. It ranges between that.
And you've not been paid that for 11 months.
Sure. And even when you combine this for a whole year, it's not up to the salary of one cabinet minister. And this is something, a peanut, which we need to be paid.
Yeah.
But have you heard anything from the ministry? We know that there was a roadmap that was supposed to have been followed in the payment after the 1 month arrears was given out or was paid.
Sure. So for that one, the ministry has been completely silent on that. We even tried to have an engagement, but hasn't been successful. For the payment plan, as of now, we don't know of it. But hopefully, our mother union, Ghana Registered Nurses and Midwives Association, has assured us that they are going to help us engage the ministry within the week. So we are just hoping that something better would come out of that.
Share with us, there's over 6,000 nurses and midwives. Let us know which are the facilities you work in.
We work across Ghana, all facilities ranging from teaching hospital to the CHIPS compounds and the clinics, everywhere we work. And what I'm even more of concern is, most especially the enrolled nurses, the community health nurses. Most of them do work at the CHIPS compound. At times they run 12-hour shifts. They will go sleep midnight. People will go wake them up in the villages where even medical supplies do not go on time. Like they try, some handle, harmful substances like blood products without gloves. But these people are even paid the least within the profession without any rural incentive, and it's very appalling. But we are just pleading with the government to just pay us the little we deserve.
So you have members across the country?
Sure, across Ghana, everywhere, reaching districts, sub-districts.
What is the timeline? We know that next month is when you want to embark on the strike, but is there a timeline, say on this day, this date, we'll taking this action? Is there any plan, or the press conference ends it?
We do not work in isolation, as I said earlier. We work hand in hand with our mother unions, the Ghana Registered Nurses and Midwives Association, as well as the Union of Professional Nurses and Midwives. And for that matter, if after the week or after December pay, we do not get any positive feedback regarding our arrears, we will sit with these mother unions and take a decision, and the decision we take would be communicated to the good people of Ghana.
Wow. But how are people going to celebrate Christmas?
Senior, at the moment, Christmas is not part of our calendar because we even need money to settle our rent. Because it's a year now, most of us have our rent expired and the landlords are on our necks. So what we need is to settle our rent and get something small to be feeding on. So even Christmas hasn't been part of the plan because we don't have the means.
All right, so talking about the landlords, do the landlords understand what's going on? Do they see you? Do they hear you?
Oh, sure. Most of them, we try explaining to them. They understand our situation, but regardless, they are not the people who employed us. They never knew us. We are just strangers who have come to rent. So they also need their monies, although they feel our situation, but that notwithstanding, they are also demanding for their money.
Before you take leave of us, the non-payment of your arrears, is it reflecting in the work of some of your colleagues?
At the moment, we are trying our best to deliver the best health service ever we could. We are just trying that this does not impact the kind of service we render, because the lives of the good people of Ghana are very dear to our hearts. At times we feel emotionally traumatized, but we try to put body and soul together just to get our work delivered. But it's now getting out of hand, so we are just pleading that the needful be done as soon as possible to prevent any calamity as time progresses.
But now you held a press conference in the Ashanti region. Is there any plan to come to Accra and maybe petition the health ministry or let the government know what really your plights are?
Sure. So as we are still speaking with our mother unions, when we arrive at a collective decision that we should come there, we should petition people in authority, we should petition stakeholders. If the need be, after we engage our unions, we would take that decision and then do that as well.
Stephen, before you take leave of us, your final words. The general public listening to you, the authorities are listening to you, and whoever matter is actually listening to you.
I want to tell the good people of Ghana, people in authority, that looking at the situation at the moment, the Ghana health system is falling apart. So the people of Ghana should just stand in and speak on our behalf for the needful to be done, because nurses and midwives constitute over 70% of the healthcare or health service workforce. And for that matter, if we mean to lay down our tools, the health system is going to suffer. The ordinary Ghanaian who has committed no offense is going to suffer, and we don't want that to happen. So we are pleading with the good people of Ghana to be in our shoes and stand with us.
Stephen Kojo Techia, thank you so much for your time.
Thank you very much for the opportunity.
He's the convener, Coalition of Unpaid Nurses and Midwives Ghana, and they have stated their point clearly that by next month, if the government doesn't do the needful by paying them their 11 months salary or arrears, certainly they are going to lay down their tools. And you know what that means for our health sector. Over 6,000 of them not being paid in this country. And another one that he said that is really broke my heart is the fact that they are not thinking about Christmas. But I know the duty bearers or the authorities, you are looking at getting that chicken or that goat or that hamper from somebody, but be thinking about the individual that hasn't been paid, who bears or stands the chance of being sacked by his or her landlord, because the landlord,
like old family members to take care of.
Because the landlord is actually thinking, I also need my money. So if you're not paying, you'd have to move out of the room so that I can give the money, I can give the room to someone else. Another big issue is if this is not really checked, like I asked him, whether is this reflecting in the services they render? And he indicated that they are trying very hard. It
is hard.
Very hard.
It is very hard.
Not to unleash this onto patients.
It is very hard.
But
not like, as human beings, it's very hard.
Yeah.
So yes, Chale.
We should go for a break.
Yeah.
Let's engage more. We'll bring you more details on the 11-month salary that has not been paid to the nurses, and we've been talking about it. But Chris, like we said, this is a big problem that has to be dealt with, because if you've not been paid for some time, it now has a toll on your work, it has a toll on your family, it has a toll on everything that you do. But the fact that there is being a conversation with the government in somewhere 2024 and in 2025 there was some sort of payment, and now they are not hearing from the government again. It's a big thing that has to be really questioned.
Yes, I think it should be questioned, because I don't understand why we have to keep coming back to this subject, of nurses not being paid. Meanwhile, these are essential workers.
Yes.
Meanwhile, these are the people that we want to, run the hospital, because at the end of the day, without the nurses, I don't think the hospitals can ever run. And this affects each and every one of us, except those who have money, of course, to fly out of the country at any given moment to take care of their health.
And anytime I raise this, Nana Tufo will say that no. But anyway, let's engage more on this particular issue. A member on the Health Committee of Parliament, Dr. Kingsley Ajimani, is joining us for us to know the side of the parliamentarians when it comes to the Health Committee. Good morning, Honorable.
Good morning, Philip.
I trust you are doing well.
I'm well.
So in the Ashanti region, a press conference was held yesterday. 11-month salary that has not been paid to over 6,000 nurses. I want to find out from you if this has come to the attention of the Health Committee, and if yes, what is going to be the line of action that the Health Committee will be taking, at least to ensure that these nurses are sort of paid.
Well, thank you very much, and a very good morning to your cherished viewers and listeners. We always say that people drive value, and when it comes to healthcare, the healthcare worker provides a very essential service to the healthcare delivery. It's rather unfortunate that our 6,500 or so of our health workers who have been working the whole of this year, who were captured in the budget, have still not been paid. Very, very, very unfortunate, and I sincerely sympathize and empathize with them that high. We can't continue like this as a nation. How do you feel as an individual when you have worked for 11 months and there's nothing to show? You're not being compensated. Everybody has a right to work, by virtue of the UN Convention to work. Yeah, you've engaged them. It's not like it's not a situation where you are saying that you don't even appreciate their work. They go to work every day. Yet 11 months of a reset agenda, they will not be paid. When we say the government is not spending, people think they are playing politics with it. But look at the health budget for 2025. When we're considering the estimate, releases that have come to the Ministry of Health, and for that matter, 8 agencies, when it comes to all the 3 lines of budget, was just about 64% of releases. So it explains that the government is not spending. If you are not spending and you are playing politics with the economy, it's very, very unfortunate. These are workers that families are dependent on. They've rendered their services to the country and you have not paid them. Very, very unfortunate if you ask me.
But you have also been raising questions about the government not prioritizing the health sector. Do you still stand by that?
Of course. If it was a priority, you are going to buy presidential jet. You are going to do express road, new road altogether from Accra to Kumasi, where there's a road that is being improved, and the health worker has not been paid, and they are not motivated enough because they are not receiving their basic requirements or what you do them. And you expect the health worker to deliver to even excel. It becomes very difficult. It becomes very, very, very difficult. If I tell you the number of engagements these workers have to go through before protesting, it is not a joke. It is more or less like we don't need you, you can do your work, we can't be bothered. This does not appreciate the Ghanaian worker, especially essential service like healthcare. You may think that these are people offering health services at the very basic unit. First port of calls, 6,000 or so of them are circumstanced now. Very, very, very unfortunate. We have to begin to realign our priorities as a nation. Because I always say that you can't play politics with the health of the nation. Because our wealth is the source of our health. You can come up with a lot of policies if you don't have very healthy population, or if access to health care becomes a barrier as a result of workforce. It becomes very unfortunate. So, Philip, we are just urging government that health service delivery is not something we can continue to do. If we can continue to perform the way we are performing about it now. No.
But as a member on the committee, we know that the health minister now, Minta Akando, was on that same committee, and he was very vocal when it comes to issues like these. Will you be raising it on the floor of Parliament, or will you actually be asking the committee to sort of pose some questions to him and find answers to this so that the nurses could be paid?
I mean, one good thing about the work of Parliament is that, we represent the people. And these 65,000 or so are coming from various constituencies.
That's 6,000, over 6,500.
6,500 are coming from various constituencies. So every member of Parliament is our collective responsibility to ensure that we say to government what we need to say to him, so that these workers can be paid, because it has a cascading effect. Because they have dependents, they have necessities to take care of. If you are not paying them, are you saying you are terminating the appointment? Their services are still needed in the healthcare the service delivery. So we are urging government and pleading. We've gotten to a point where we have to plead that we are pleading on behalf of these Ghanaians who are engaged to serve in our healthcare architecture, that they have the right to be paid. and government must respond accordingly. It's very, very unfortunate. Especially, next week we are celebrating the Unitide. How are they supposed to spend?
Well, they said they are not thinking about Christmas.
Of course, if you don't have a peace of mind, if you are not going to be paid, how can you think of Christmas? You can't think of Christmas. Very, 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 very unfortunate. And it is not them alone. It is the numerous dependents who are also looking up to them in one way or the other. Very, very, very unfortunate, if you ask me.
Thank you so much, Honorable. We are grateful for your time. Dr. Kingsley Ajima is member on Parliament Health Committee and also the member of Parliament for Ibuakwa South, and he has said it clearly what really he thinks that the government should do. But he's also mentioned that some sort of questions we put, though every member of Parliament in the House can also go ahead and do that. I remember very well the health minister now, Dr. That is Minta Kando, Kwabena Minta Kando. He is very vocal when it comes to these things. I know he went to Kolebu to actually question why the lift there wasn't working, and when he got there,
we all saw that.
Yes, there was sort of
banter,
a pushback that you didn't tell us that you were coming here just to come and check elevator or to check whether the lift is working or not. So I know what Kwabena Minta Akando can do, and I know what is being done in the health sector. But now that you are at the helm of affairs, maybe you would want to see what you were doing then when you were the ranking on the health committee, and what you can do now when you are now the Minister of Health, because there are a number of things that must be done in the health space. And the biggest and the most important resource you can ever think about in an organization is the human resource. You can't take it away. You can bring the money, you can bring the cars, but it's a human being that must man all these things. And if you're not treating the human being well, the human being who is going to man all these things, you're not treating him or her well, it's certainly going to reflect in the work. And now the standards may fall, and we're asking ourselves questions every now and then, and we complain, we're saying that our health sector is not how we are supposed to see it. And now when someone is sick, the person will run away and go and seek health care elsewhere. Where in a country where their staff are paid well, in a country where the staff will not go on a strike, in a country where there is a priority to the health sector. You think when you go to the US and the US government is not paying their nurses or their health workers, you'd be able to go there and go and get the health care you need? Or you think that the health center or the health facility will be in a very good shape, and you would go there and go and get what you need, and you run away from the country? Like I've always been saying, that if these people are kept in the country and they are not given the chance to go elsewhere to go and seek health care elsewhere, they will do things better in this country.
They will fix
yes,
it.
you'll fix it in this country. And it starts with a human resource, and a human resource is what is calling over 6,500 workers. They've not been paid, and it's okay that you've not communicated to them as of now. The press conference was held yesterday, and as we speak right now, from what the convener said, you've not even picked your phone to even say, hey, convener, this and that and that and that is what we want to communicate to you. We should put politics away. The health sector is what we all need in this country. If I'm sitting here and I get sick right now, I'd have to go to a health center, and you go there with National Health Insurance card. That is the public sector would maybe receive it, but maybe some of the private sectors or some of the private facilities may receive it.
Some may not. Some will, and then some will prefer private insurance. But if you do not have any of that,
and that woman in the deprived community will not be able to get that treatment because that worker, the health worker, hasn't been paid for 11 good months. 11 months. If there is a problem that has to be fixed, it has to be fixed well. If there is some sort of clearance that has to be done, it has to be done well. We are calling on the Finance Minister, Dr. Kasela, to force in. If something has to be done, it has to be done now. If Kwabena Minta Kando is not getting the funds that is needed, it has to be given to the health sector or to the health ministry to give to these nurses. Because even if people are not working and they are sitting in their homes, you be okay and you say that you want to pay them, they have gone to the workplaces. They have gone there. From what the convener is telling us, across the country, people are in chips compounds that they are battling with reptiles. They are battling with snakes, but they are still there.
We actually have a message right now, and this is a very sad message. It said, Breakfast Daily, right now, I'm just in my room crying. I can't even afford a single meal to eat today. I'm part of them, but I have not received even the one of 1 month.
And this person is in his or her room and crying because the person hasn't received between the 2,000 to 4,000 Ghana cedis he or she has to get and survive. And what the convener said, if you pile up or you add up this entire money the whole year, it's bigger than the money you are taking. It's smaller than the money you are taking. It's smaller than the money you are using to fuel your car, because your vehicle that you are fueling a day, when you do one boom, you accelerate. You are buying about 1,500 Ghana cedis fuel. It's a serious issue, but sometimes we have to let the authorities know that it's not easy. As a youth myself, if I do not have money, see, I will be thinking and be asking myself where the next meal will come from. The battle that you would have to fight, that you are not getting food. A lot of things will be coming into your mind.
I see, and people do not realize that their job is not as flexible as many other jobs.
Because they are called
exactly. As you can say, or someone might say, "Oh, go and do something else by this time if you're not getting money," or then you can go back to nursing. It's not like that. Sometimes they spend 12 hours. Sometimes they do more than that, and it's a very terrible situation to find yourself in, because you cannot do anything because you have also pledged to take care of lives. So you cannot ignore the lives of people.
And this is people trying to survive. The fact that they've gone to the nursing training schools, the fact that they've been able to take up this mantle, and we're like, I want to be a health worker. The person should be treated well. The more reason why we are getting this exodus. People are moving
exactly what I was about to say. People are leaving
other countries
elsewhere
to go and seek for greener pastures. And you'll be losing these workers. This is the brain drain that you've been talking about. The person who is very good at his or her work in the facility, the person they are not even paying me what I'm worth. They are not even minding me. Not even the 2,000 Ghana cedis that they want to give me. It's even now in arrears. So why will I want to stay in this country? And the person will move. And when the person moves elsewhere, the danger is that the person is creating the opportunity for other people to come, because the person will call her friends or his friends and say, hey, here is better.
It's better.
So you
they
want
are paying
to come.
here.
Yes.
Yeah.
But
leave that job.
We would have to find ways and means to resolve these issues. Health workers are begging that they should be paid. Yesterday there was another demonstration that was held, I think, with the environmental officers. These tankers people that they also held some sort of stage a demonstration. So the question that we are always asking is, will the youth continue to suffer like this when we just want something small to feed on? And we always vote and we always ask the authorities to come and sit there. Minta akando, kwabna minta akando, you can do better. If you are not telling them that you pay the money, just communicate to them that there is a plan. And the fact that you've communicated to me that there is something you are working on, I'm okay, and I'm going to hold you accountable to what you've communicated to me.
And sometimes, let's be realistic, communication is not enough. They should find money and pay them, because the landlord at home.
Look at the message that is coming in.
The landlord does not understand you talking.
Hold on. Dear hosts, what is stopping you as journalists to ask the government directly instead of the same noise making sat on what your backside? No, we are asking the questions. We are asking the government. You can't say that what is stopping us from asking the government.
But that's what you're doing.
That's what we are doing.
That's exactly what you're doing.
That is what you are doing. You see the same thing I'm talking about in this country, that sometimes people are politicizing things and it's worrying us. And you that you are watching us and you are sending this message, you go to the hospital and you not go and see the nurse or the doctor there or the health worker there, and you come here and you come and tell us that we should talk for you. Let's go for a break.